Hello, welcome to Holistically Speaking. My name is Morella DeVoe. I'm your host. Today I'm joined by Dr. Bill Warnock. He is a naturopathic doctor, and this is the third of our shows focusing on cancer and exploring alternative perspectives on cancer and what these different practitioners have to share, how they work with people who are dealing with cancer. Thank you so much for joining us, Dr. Warnock.
You're welcome. Thanks for having me.
Yeah, we've been wanting to have you on the show for a while, so I was very, very happy that you were able to come today because, as I was telling you before the show, I have heard of different people talk to you about, as the naturopathic doctor to go to, particularly with cancer, because you've had so much experience in Vermont. And you are the first licensed naturopath in Vermont. So
I've been practicing since 1985, seen hundreds of cancer patients, yes.
Yeah, so it's a pleasure and an honor to have you here, so thank you. So just assuming that perhaps our viewers are not too acquainted with what naturopathic is, could you share with us, just in general, what a naturopath does?
Sure. Naturopaths are licensed healthcare practitioners in Vermont. We've received 4 years of naturopathic medical school training after our bachelor's degree at whatever college we attended. And our scope of practice includes the ability to diagnose and treat illnesses. Our primary focus is natural treatment, herbs, vitamins, diet, exercise, all the things that try to keep a person as healthy as possible. And we are able to prescribe certain medications if necessary, but unlike MDs, for example, our first way of looking at a person and trying to help them is with these natural products, and the prescription medications only come at the end or when they're needed, to absolutely help that patient.
So what's interesting is, as I'm hearing you talk about it, your field, it seems like it straddles both worlds, where some practitioners of alternative health, they're just exclusively alternative health and almost are against Western medicine sometimes, it seems, but you kind of occupy a little bit of both places and look at both approaches. Is that a fair?
Exactly. I have no bias against Western or conventional medicine. In fact, I embrace it. I do lots of referrals for patients. I'm primary care provider for hundreds of patients. And so I'm always interacting in that realm. I guess if I was to have a bias, it's to keep my patients as healthy as possible, and by whatever means I have available to me.
And so your tools might be a prescription medication, but then you also work with food and...
Exactly. I only use prescriptions when they're the best choice, and the other things aren't working. For example, if a person has a deer tick bite, I'll prescribe an antibiotic. Or if a person has very high cholesterol and the natural things we've tried haven't helped, then I'll prescribe a statin medication.
Okay, so now that we've kind of gotten a feel for our viewers to get familiarized with naturopathic health, when we start to think about the diagnosis of cancer, does a naturopathic doctor look at it from a different perspective? Is there a different view of cancer that you would want to share?
The cause of cancer is varied, and I'm only speaking from my point of view rather than the general naturopathic point of view, but you could say that cancer is a genetic change in cells of some kind that allows them to grow in a specific way. You could say that cancer is a failure of the immune system to recognize the cancer cell when it's just a few cells, and to get rid of them or bring them back into the fold of the normal cells. You could say that cancer from another point of view is an attempt to make a person have changes in their life that allows them to grow as a spiritual being. So all those could be correct, and probably are. So the cause of cancer is multifaceted.
Yeah.
And so the treatment has to be as well.
Right, right. And so when you're working with one of your patients who has come to you because they have a cancer diagnosis, what are some of the things, what would your approach include?
There was a study out of Zurich, Switzerland, maybe 10 years ago, that showed that the first quality of a long-term cancer survivor was the ability to take control of their own treatment. So this is the kind of person who gets a second or a third opinion. Instead of doing everything the doctor says, they question it and say, well, should I do that or not? And they might not do exactly what the doctor says. And that doctor might include me as well. I might make recommendations, and the person, I don't think I'm going to do that one, but I'll do this one. And those are the kind of patients that take a lot more time, but I always try to encourage that.
Right.
And if a person says, I'm not going to do everything you said, I don't get my feelings hurt or my ego damaged by that.
Yeah.
So that's the first thing I encourage a person to do.
Well, and that's a beautiful thing, which we haven't talked about in the previous cancer shows, but it's what I'm hearing from you is the sense of personal empowerment, that I'm the one in charge of my healing, and I, take personal power, personal responsibility, versus a lot of times people just feeling like they're the patient and that they're just following.
Right. We've developed an interesting relationship, doctor-patient relationship. The patient is really paying the doctor for their opinion, for their expertise, and they should approach that relationship in that way. I'm going to listen to what you have to say, but I'm going to be making my own decision. Now, I have had patients who have gone to doctors who have said, if you don't do exactly what I'm saying, I'm not going to have you as a patient. And I think that that's almost criminal, to tell the truth. Right.
So can you tell me a little bit more about that? Why would you call it criminal? Like what?
Well, because it is disempowering the patient, and it's putting the doctor on a pedestal that's higher than the patient rather than, I think, the correct relationship.
Right, right. Along those lines, the other thing that sometimes disturbs me a little bit is when someone is told by their doctor that they have an X% chance. It's like that to me is a little disturbing in terms of telling someone this is the possibility that you have. Do you ever see cases like that?
I do, but that's not something I blame oncologists for, because we live in such a society that everybody's suing everybody, and it's really important to be honest with a person so that their expectations aren't different than the reality.
Yeah.
When I diagnose a person with cancer, or suspect a person having cancer, of course I refer them to the oncologist, but I always say, the statistics say that the average person is going to live so many years with this type of cancer.
Yeah.
But then I say, those are statistics and you're an individual, so I I don't have a crystal ball to say how long you're going to live, and we're going to do everything we can to try to make it as long as possible.
Right. So going back to your approach, you said your first step was that piece of personal empowerment, of making them take charge, take the reins. So what follows that? What are some of the things that you tend to offer?
Well, obviously, if a person's coming to me, they're looking for my expertise, which is in that natural health arena.
Yeah.
So I would say 99% of the cancer patients I've seen are seeing an oncologist as well. And I encourage that, at least to get that piece of information. A lot of my patients are resistant for various reasons, fear or, bad experiences or whatever it is, to get entangled or seek the advice of the standard medical community. But I still encourage that, because that can be a vital piece of information for them in making the right choices for their treatment. So most of my patients that have cancer are getting surgery, and I'm certainly encouraging that. Radiation or chemotherapy, the patient has to be the one who decides that, but most of my patients, when appropriate, are getting those therapies as well. So one of the first things I'm doing is supporting them in helping to make those therapies as effective as possible.
Yeah.
Reducing the long and short-term side effects of those therapies as much as possible. And keeping their immune system as strong as possible throughout the treatment.
Yeah.
So there are basic vitamins, and if you're looking at probably the two most important vitamins for boosting the immune system, it would be vitamin C and vitamin D. With vitamin D, studies are coming out all the time showing that higher amounts of vitamin D are more effective than lower amounts for boosting the immune system and helping it fight against different types of cancer. So I've tested thousands of people's vitamin D levels in Vermont. The most accepted blood levels of vitamin D are 30 to 100 nanograms per milliliter in the blood. If a person's not supplementing with vitamin D at all in Vermont, no matter how much sun they get, they'll be below that 30 nanograms per milliliter, even in August. Even if they're a farmer working outside all summer with their shirt off, there's just not enough sun in Vermont. I like people's levels to be over 80. In fact, there was a study about a month ago that showed that in this 30 to 100 blood levels, the people in the upper 25%, which would be over 85, had 20% lower deaths from cardiovascular disease than the people in the bottom 25%, which would be less than 45.
Wow. That's a significant correlation.
It is, and it takes about 5 to 10,000 international units a day to achieve those levels. Now everybody's different, responds differently, so I usually put a person on 5,000 IUs a day and then retest after 3 months.
After 3 months.
To see where they're at. So anyway, getting your vitamin D levels over 80 is the first thing I do, and if a person doesn't do anything else than that, they're going to gain a lot of benefit from that. Vitamin C, now vitamin C is overlooked. A lot of people take it when they or coming down with a cold.
Yeah.
And why do you do that? It's because you want to strengthen your immune system. In fact, there's a type of immune cell called macrophages that need vitamin C to become activated.
Oh, okay.
Our immune cells are produced by our bone marrow and have a lifespan of about 6 weeks.
Oh.
During that lifespan, for the most part, they are inactive.
Unless something starts happening.
Something signals them to become activated. Well, so that particular group of immune cells needs vitamin C to become activated. Most people are unaware that human beings are only one of 6 known species of animals who do not make their own vitamin C. We can get 60 to 80 milligrams of vitamin C out of our diet if we eat plenty of fruits and vegetables.
Right.
But other animals are making vitamin C at the rate of 4,000, 20,000 milligrams a day when extrapolated to human body weight.
Wow.
So those higher levels of vitamin C are really important. And if a person has cancer, I have them raise their vitamin C levels up to bowel tolerance, which means at a certain point, your intake of vitamin C is not going to become absorbed, and it's going to cause
runny stool is it?
Yes, exactly, loose stools. And then I have a person drop below that point to make sure they're absorbing all the vitamin C that they can. And vitamin C is used up fairly quickly in our bodies. It has a short half-life of only a couple of hours. So I'd like people to take that at least twice a day.
Gotcha.
So if a person does nothing else, vitamin C, vitamin D, they're going to get a lot of benefits. Now, most oncologists, especially with chemotherapy, don't want a person taking vitamin C on the days of receiving the chemotherapy. And, you know, I work around that with patients.
Yeah.
And so I want to respect what those oncologists are thinking as well.
So it sounds like, for the most part, you're working with someone, offering them, the word's escaping me, but it's like a parallel treatment in addition to their standard care?
Complementary.
Complementary, yes. So do you ever work with people who say, I don't want to do the whole chemotherapy, radiation, I just want to do this naturally? Have you encountered people?
I have worked with people like that, and while I'm not encouraging that, I am respecting that decision, and I continue to work with them along these lines. Now, these 2 vitamins I just mentioned are just part of the treatment.
Right.
I'm just going to mention a couple others that I would recommend: coenzyme Q10, melatonin, curcumin.
Yes.
So I'm not going to get into details with those, but there's quite a few things a person can take that can be very helpful. The other thing is, well, I guess I'll mention this now, is mistletoe extracts. And in Germany, let's see, I think it was about 10 years ago, one of the brands of mistletoe extract that's used to treat cancer called Iscador was named the drug of the year by the conventional pharmacists in Germany.
Wow.
And it was named the drug of the year because it was prescribed more for cancer treatment in Germany than any other medication. In fact, over 60% of all cancer patients received mistletoe treatment in conjunction with their standard treatment.
Wow, that's incredible that an herbal, so it's just a mistletoe extract?
Yes.
And that's the #1 treatment in Germany?
It was 10 years ago,
10 years
and
ago.
I imagine it still is, but I don't know for sure right now. So it's been this gives, the way it works shows how the immune system works as well. So I'm just going to give a brief explanation there. There's a type of immune cells called natural killer cells, and these cells are very amazing when you realize what they do. They were first named natural killer cells because under a microscope they would come up to a cancer cell or a cell that was infected with virus, and they would touch the cell, and the microbiologists called it the kiss of death, where that cell would just die.
Wow.
After it had contact with these natural killer cells. And studies over the years have shown that natural killer cells can do more than kill a cell, but they come up to a cell and they're able to somehow read that cell's DNA and RNA. In other words, it's almost like they're bouncers at a club or something, and do you have an invitation? Oh, that's a forged invitation, you don't get in, or something like that. But no one knows quite how that DNA is read just in that millisecond of contact.
Yeah.
But the first thing the natural killer cell tries to do is to fix that DNA, to repair it.
Right. Wow.
And so they give signals to these cells how to repair their DNA. But if they're broken so much that the DNA can't be repaired, then they switch on the DNA that leads to cell death. So every cell has programmed death in its DNA, that if certain genes are switched on, the cell dies.
The cell dies.
And that's activated by these natural killer cells.
That's incredible.
Well, sometimes the cells are so broken that programmed cell death doesn't get switched on. Then the natural killer cells release hormones or signals into the blood to call for these other...
For reinforcement.
Yes, exactly. Other immune cells to come and start attacking and trying to get rid of the cell by external means. So that's just
wild.
Totally amazing to me.
Yeah.
Now, these natural killer cells fall into this category of having a 6-week lifespan and circulating around in the blood and never really being activated for the most part. So the thing about cancer is that it is able to fool the immune system, or else the immune system is weak. So, weakened immune systems we know lead to higher cancer rates.
Right.
But cancer cells also have the ability to fool the immune system so not to activate these natural killer cells. So that's one of the problems with cancer.
So is this where mistletoe comes in?
It is, because that's what mistletoe does. It activates those natural killer cells into thinking that there's an infection going on. So they travel out of the blood on, their search and destroy or search and repair missions, whatever you want to call them, and they're able to find these cancer cells. And something like this was shown in a study in Lancet, which was a British medical journal about 1986, I think, where a survey was done in England with a big survey, 50,000 people, and they spent 3 days filling out forms of trying to identify all lifestyle factors that might increase cancer rates or decrease them.
Yeah.
And they didn't find a thing. Diet, whether you live near power lines, the kind of job you had, none of that was statistically significant, except for one thing. And that was if a person had a viral infection with a fever in the 5 years prior, they were much less likely to come down with cancer.
Oh my goodness.
And guess what a virus does? It activates the natural killer cells.
Wow. That's incredible. And so they started using it became a treatment then?
No, it was just noted. Let's
Noted.
just say it was noted. But
Okay.
that's where, you know, things aren't black and white. So if a person has a viral infection with a high fever every now and then, that's not necessarily a bad thing.
Right.
And good health may be getting those sort of things periodically.
Right.
And not so good health might be never getting a fever.
Right. Yeah, and one of the things that I'm always marveled is kind of the, I don't know if marveled is the word, but the aversion that we have to getting sick, you know, getting a cold or getting, it's actually like giving your immune system a workout, you know, to get stronger and healthier. So this is kind of a parallel what you're saying.
Definitely, and then we become germaphobic, you know,
Right.
and have all these antibiotic cleaning products, and so
Right.
a person doesn't really get that exposure that would activate their immune system and make it strong.
So time has flown by and we have only a couple more minutes left. So you've told us about vitamin D and vitamin C, which sound that they're, as you were describing them, are preventive to a certain extent. You know, if your vitamin D levels are optimal, there's likely some element of prevention that's happening.
That's true.
And vitamin C, would you say as well?
Preventative and also for treatment, yes.
Yeah. So is there anything else that we can, to wrap up the show, that we could share with viewers in terms of what could I be thinking of if I want to improve my chances of staying healthy and not developing cancer?
We all have an intrinsic sense of, we call it sense of well-being, don't we? Mm-hmm. We know, but we often don't trust what we should be doing,
Yeah.
what foods we should be eating,
Yeah.
how much sleep we should be getting. You know, we know that we should be drinking lots of water, know that we should be exercising, we know that we should be spending time outside. Mm-hmm. We know all these things that make us healthy. We don't quite trust them or don't have time to follow our instincts.
Right.
You know, in a certain sense, I think that cancer, when a person receives that diagnosis, can be very transforming towards that, you know?
Yeah.
And that sense of well-being is also a sense of what truly makes a person happy and fulfilled in life as well.
Right.
And I've seen cancer, you know, when it comes down to it, really transform a person so that they got back to that sense of well-being and really became a more fulfilled, happy person.
Yeah. And in that fulfillment, better health, and it's almost like which came first, you know, creating the fulfillment that helps them create better health, or vice versa, and it's...
well, we don't have to go with a cause and effect.
Right.
It's all just part of where we should be heading, you know? Why are we here, and what is our goal in life?
Right. So just to wrap up, I want to show viewers how to contact you. This is your website, the Champlain Center for Natural Medicine, and that's my phone telling me that we're out of time, vtnaturalmed.com. So anybody who's looking for support with their cancer treatment and looking for a different opinion or some sort of advice, they can reach you through your website. Thank you again for joining us. It was really a pleasure to have you and listen to your perspective and how you help people. So thank you so much.
Yeah, it went too quickly, didn't it?
It did. It did.